fossa over here clearly, and then below that you can see that ulna, upper end of the ulna and upper end of the radius also by side. So if they are appearing on the side by side, that means it is on the anterior-posterior direction. It is in the anatomical position. Get it on? So radius and ulna and auricular fossa can be clearly seen in case of that's what. See, so the thing is over here, the X-rays will be passing from anterior to posterior direction. The major fossa, the major structures will be displayed on the X-ray plate. Getting it on? Whenever you're passing from, okay, for example, see here, the ribs are there. Is it not? The ribs are there, right? So part of the rib can be seen, part of the rib can't be seen properly. Is it not? Because the X-rays are passing through and through. One part of the rib will be focused and the other part will be less focused. In the same manner, the fossa, whatever you are seeing over here, are coronoid fossa and radial fossa are dominated by the presence of the olecranon fossa over here. Because olecranon fossa is bigger compared to the radial fossa and coronoid fossa. Okay, that's why olecranon fossa can be seen over here. So, not the presence of the fossa or the other things. Whether the fracture is there or not is the main concern over here. Okay, getting it? Okay. So don't worry about the fossa and all the impressions and everything. Whether the cortex is broken or not, over here and over here. So that is the main concern in case of radiology. Okay. So to understand that it is the anterior-posterior view, you can see the auricular fossa and the anterior or posterior aspects of the upper end of the ulna and upper end of the radius over here. Getting it? Right? But if you take on the lateral view, this is the lateral view and the patient will be keeping the hand in this manner. Getting it on? If he is taking the left-sided arm view, lateral view, the X-rays will be passed from backwards towards this side. Lateral view. Getting it over? The X-rays will be passing from all the way from just like my mic over here. The X-ray will be passing over here in this manner and the arm will be focused in this manner, the lateral view, because this is anterior-posterior view from the anterior to posterior direction. This is a lateral view from medial direction to the lateral direction in this manner. Getting it over? So that's why you can see there is a shift of the scapula over here. Earlier there was not any shift of the scapula. Is it not? The scapula is behind the thorax over here. But later in this X-ray you can see there is a shift of the scapula from posterior to the lateral direction in this manner. Will you able to see that? Yes. So there is a shift of the arm in this manner and you can see there are no upper, of course there is an upper end of the radius and ulna over here, but it is horizontally located. Will you able to see that? And there is an overlap of the radius and ulna at the level of the coronoid process. Will you able to see that? Yes. So this is the auricular process over here and this is the coronoid process over here. This is the shaft of the ulna and this is the radius and you can see the radial tuberosity over here. So in case of left forearm, you have to see the radius on this side and ulna will be on that side. Isn't it right? But we are seeing radius on that side and ulna will be on this side. So it is not the main concern. Whether the bones are visible or not is the main concern over here. Getting it or not? So there will be appearing like a shift over here. Okay. But it is not the shift, it is about the passage of the X-ray over here. Getting it or not? So this is the radius and this is the ulna. But here it is mentioned that it is a left-sided view over here. Left-sided X-ray over here. So this is the entire humerus. You can't see any auricular fossa now. Is it not? Earlier we have seen the auricular fossa over here, but in this view you can't see any auricular fossa over here because it is on the lateral aspect. And you can see the trochlea and the capitulum are getting overlapped over here, right? So we are least bothered about on which side the auricular, the capitulum and trochlea are located. But whether there is a fracture or not and the view are the main concern over here. Getting it over? Right. You can see that this is a lateral view of the humerus and you can't see any deltoid tuberosity, the elevation of the deltoid tuberosity over here. Because you are taking in this manner, right? In this manner you are taking. So deltoid tuberosity is located over here, not on the sides. Okay. So you can't see the deltoid tuberosity over here. Getting it over? Right? Everybody postprandial sleep? Anybody? Anybody postprandial sleep is after food, you will be getting some sleep? No. Because all the blood will be focused on the abdomen, the stomach. So you will be getting the sleep. Anybody is there like that?
No.
Pakka?
Kargun page. তুই ধর অনেকক্ষণ দেখ আমার হাতে লাগছে
arm over here. So how we will describe the X-ray over here? It's a plain X-ray, lateral view of left arm. Okay. It's a plain X-ray. Lateral view of left arm. How can you say it is lateral view? Because you can't see any auricular fossa over here, and then there is an overlap and side views of these upper end of the ulna and upper end of the radius over here, and there is absence, not absence, there is a invisible radial tuberosity over here because of the view. Deltoid tuberosity over here. Okay. So that's why you can say that this is as the lateral view over here. So based on the presence and absence of these structures, you can identify whether the X-ray was taken anteroposterior lateral views. Okay. And then followed by the elbow joint. So here